Welcome to today's deep dive. Imagine walking up to a house that is just absolutely engulfed in flames.
Okay.
Like smoke is billowing out of the shattered windows, the roof is audibly caving in, and the sheer heat is radiating off the property. And instead of calling the fire department, you grab a paintbrush, walk right up to the burning siding, and decide to give it a fresh coat of paint.
I mean, that sounds completely absurd. You wouldn't try to decorate a structure that's actively collapsing.
Right. But when it comes to tackling severe addiction, that is an incredibly common trap.
Yeah, it really is.
We constantly see this, stark dividing line in how people approach recovery. People either rely entirely on clinical chemical treatments and just completely ignore the mind, or they swing wildly to the other extreme.
The holistic extreme.
Exactly. Rejecting modern medicine entirely and trying to just, meditate the fire away. They pit holistic healing against modern medicine as if you have to choose a side. But today, we're exploring a highly nuanced approach that demands both.
And it's a really fascinating perspective.
It is. We're diving into the philosophies of Osman, who's also known as the blind Muslim yogi. He's an energy healer, a yoga and meditation teacher, and an entrepreneur who argues that to survive addiction, ancient natural sciences and modern medicine must act as allies, not enemies.
Right, and to really understand his framework, we have to establish the most critical rule of his entire philosophy right off the bat.
Yes, the non-negotiable rule.
Exactly. Osman makes this incredibly clear. Natural therapies, yoga, meditation, energy healing, they are strictly complementary.
Not a replacement.
Absolutely not a replacement for clinical medical treatment. If you have a medical condition or if you're dealing with a serious addiction, his very first instruction is that you must seek the consultation and treatment of a qualified, registered medical professional.
Which is surprisingly grounded, for someone with nearly 5 decades of practice in ancient sciences.
Yeah, he's very pragmatic.
He's literally telling you to go to a conventional medical doctor first. So, okay, let's unpack this. Before we can even touch on the benefits of yoga or energy healing, we need to understand how Osman actually defines the battleground of addiction. Why does he draw such a hard line in the sand about medical intervention?
Well, he draws that line because he views addiction as a massive two-front war.
Go.
You have the physiological component on one side and the psychological component on the other. And the physical reality of the human body simply cannot be overridden by sheer willpower alone.
So going back to that house on fire analogy,
Right.
if addiction is the fire, the physiological component is the actual blaze consuming the walls. It's the immediate structural threat.
Exactly. You don't start by doing a mindfulness session in a burning living room.
You need the fire department first.
You absolutely do.
But what does that actually look like on a biological level? Why is Osman so strict about seeking a chemical medical intervention as step one rather than just, toughing it out?
Well, trying to tough it out, like deciding to just quit cold turkey on your own, it's not just difficult. Depending on the substance, it can be a severe physiological crisis.
Because the body is dependent.
Right. The body has literally adapted to the presence of the substance. It has altered its own chemistry to accommodate the drug. So removing it abruptly without medical supervision, that throws the entire central nervous system into chaos.
Wow.
Yeah, the withdrawal symptoms are not just cravings. They can be violent, dangerous, and sometimes even fatal.
So you really need the doctors.
You need precise chemical intervention to safely step the body down and manage those acute physical withdrawals.
I want to pause on the word substance for a second because Osman casts a really wide net here.
She does.
When people hear rehab, they almost always picture illegal narcotics. But he is defining addiction much more broadly, isn't he?
Oh, absolutely. He explicitly includes legal pharmaceutical drugs.
Like things prescribed by a doctor.
Exactly, things you pick up at a pharmacy, like painkillers. And he includes alcohol, cigarette smoking, and crucially, he points out food addictions.
Oh, wow. Food addictions, too.
Yes, excessive eating, binge eating, severe sugar addiction. The underlying mechanism of chemical dependency and physiological hijacking is present in all of these.
So the hooks are deep, regardless of whether the substance is legal or illegal.
Right. So the requirement for a managed medical approach applies across the board. The absolute first step is utilizing a drug rehabilitation center or a medical clinic.
Because a rehab center isn't just a place that locks the doors to keep you away from the drug, right?
Yeah.
It kind of acts as a physiological clean room.
That's a perfect way to describe it. A qualified clinic provides the necessary medical support system.
Yeah.
They guide you on exactly what to expect for your specific type of chemical withdrawal. They refer you to the right psychiatric or medical professionals, and they manage that acute physiological fire.
So that the person survives long enough for the rest of the work to even begin.
Exactly.
But, okay, if the rehab center acts as the clean room, like if they manage the physical withdrawals and get the person completely cleaned out of the chemical, so they walk out the doors, physically speaking, as a brand new person,
Right.
why does Osman dedicate so much of his life's work to what happens after they leave? I mean, if the physical dependency is broken, shouldn't they just be cured?
Well, that assumption is exactly why so many people fail in recovery.
Oh,
The grim reality that Osman outlines is the relapse timeline. Rehab handles the physical detox, it clears the substance from the bloodstream, and stabilizes the nervous system.
okay, but
But the psychological habituation remains virtually untouched. The deep underlying reasons why that person turned to the substance for comfort in the first place.
the trauma, the stress.
Right, the environment, all of that remains a massive gaping vulnerability.
So the fire's put out, but the house is still sitting in a pool of gasoline, just waiting for a single spark.
That's exactly it. And the statistics he points to are incredibly sobering. The vulnerability is actually highest immediately after the physical detox.
Really?
Yeah, people very often relapse within weeks or months of leaving a rehab facility. It is incredibly common for them to fall right back into their old habits within a single year.
That's tragic.
It is. But what's fascinating here is the most striking part of his timeline. Even among the minority of people who successfully managed to stay clean initially, a large proportion of them still relapse within a 10-year period.
Wait, a decade later.
A decade later.
You could be completely sober, rebuilding your life for 10 years, and still be at imminent risk because the psychological foundation was never structurally reinforced.
Exactly. Because addiction is not just a habit you drop. It is a systematic dismantling of a human being.
Wow.
Osman has a really powerful description of what this cycle of addiction and relapse actually does. He describes it as a process that removes every last straw from a person's life.
I want to dig into that phrase, every last straw, because it initially sounds a bit like grasping at straws, but he means something much more devastating in terms of structural collapse.
He does. He means the complete erosion of every pillar that holds up a functional human life.
Right.
It isn't just a localized health crisis in the liver or the lungs. It destroys the social structure. It alienates friends and dismantles family relationships.
It affects everything.
Everything. It destroys the capacity to be financially independent, stripping away careers, and the ability to simply support oneself.
Gets heavy.
And it gets worse. The addict often loses their loved ones or inflicts deep trauma on the ones who refuse to leave. Ultimately, Osman says you lose your character.
Your actual character.
Yeah, the addiction demands so much that it compromises your morals and your identity. Every single support mechanism you have is systematically destroyed.
It's just a terrifying picture. You are left with absolutely no scaffolding to hold you up when the next wave of stress hits. And knowing that relapse is this persistent decade-long threat, well, here's where it gets really interesting. This is where Osman introduces the ancient sciences.
Right.
Not as a magical cure that you just sprinkle over the trauma, but as the actual structural reinforcement.
Yes.
If the medical rehab clears the burned land, yoga and meditation are the blueprints and the raw materials used to build a fortress so the house doesn't burn down a second time.
That's a great way to put it. And when he addresses the question directly, like, can yoga, meditation, and energy healing cure addiction? He gives a very nuanced answer. He says no and yes.
That dual answer is fascinating. Walk me through the no first.
So the no ties directly back to his absolute insistence on medical intervention. They cannot do it alone. You cannot sit on a yoga mat and simply breathe your way out of severe chemical withdrawal or organ failure.
Right. Ancient practices do not replace the fire department.
Exactly. But then comes the yes.
Okay, what's the yes?
The yes is about the long-term survival strategy. These practices provide the essential mental strength needed to even seek rehabilitation in the first place.
I see.
And more importantly, they provide the psychological fortitude to follow through with the program long-term.
I want to push on that concept of mental strength because it can sound a bit vague to some people.
Sure.
Are we just talking about feeling a bit more relaxed, like you take a deep breath and suddenly you don't want to drink anymore? How do these ancient practices actively intervene in an addicted brain?
It's significantly deeper than just feeling relaxed. It's about active physiological and psychological management. Think about what addiction does.
Okay.
It hijacks the body's ability to self-regulate. When stress hits, the addicted brain screams for the chemical to artificially induce calm or pleasure.
Right, it needs that quick fix.
Exactly. And Osman explains that yoga, meditation, and energy healing, they act as somatic therapies.
Somatic therapies.
Yeah, they literally help the nervous system relearn how to find a baseline of calm without chemical spikes. They train the body to sit with discomfort, to regulate breathing, and to manage the physical sensations of anxiety that would normally trigger a relapse.
So you are giving the person a tangible internal toolkit to handle the exact stressors that previously drove them to self-medicate.
Precisely.
You are rewiring the circuitry so that when the power flickers, the whole city grid doesn't just blow out.
That's exactly what's happening. It makes the transition out of the clinical setting easier and significantly increases the likelihood of that behavioral change becoming permanent.
That makes so much sense.
And Osman takes this a step further. He points out that these practices are not just for the post-rehab patient. They also serve as a vital preventative barrier for what he categorizes as borderline individuals.
Okay, define borderline in this context.
Yeah.
Are we talking about someone who is genetically predisposed to addiction or someone who is, like, actively experimenting?
It's more about the behavioral pattern. These are people who are beginning to use food or drugs or alcohol as a primary coping mechanism.
I see.
They are dealing with deep psychological problems, severe anxiety, or highly stressful environments, and they're using these substances to numb the pain.
But they aren't fully addicted yet.
Right. They haven't necessarily hit the point of complete physiological dependency, but they are walking right on the edge of the cliff.
They are using the substance to artificially manage their nervous system because they just don't have the natural tools to do it.
Exactly. And Osman argues that before you ever cross over into full-blown addiction, engaging deeply in yoga and meditation can intercept that process.
It builds a barrier.
Yes, a psychological barrier. It gives them the coping mechanism they are desperately seeking, preventing them from crossing over to a point of no return where clinical rehab becomes the only option.
Okay, let me play the skeptic for a second here.
Go for it.
If I am one of those borderline people or even someone who just got out of rehab and is trying to rebuild my life, why can't I just pull up a 10-minute yoga tutorial online? Or download a basic meditation app? Like, why does Osman insist so heavily on the necessity of professional instruction?
Because there is a massive difference between temporary symptom relief and deep structural healing.
Okay.
Osman draws a very sharp distinction between seeking a little comfort and achieving what he calls substantive improvement in managing your body and mind.
Meaning a 10-minute video might lower your heart rate for an hour, but it isn't going to rewire decades of trauma or deeply ingrained addiction habituation.
It won't. It just won't. To achieve deep, lasting psychological and physiological benefits, you need an expert who understands the profound complexities of what the body is actually going through.
You need a real guide.
Exactly. You need someone who can guide you safely through the mental resistance and the physical blockages. And when you look at Osman's own background, it really sets the benchmark for what that level of expertise actually entails.
Yeah, his background is frankly staggering. We're talking about over 44 years of teaching yoga and meditation and nearly 5 decades of personal daily practice.
It's incredible. And over those decades, he has treated thousands of patients across dozens of different nationalities.
Thousands of patients.
Yes, he has seen every permutation of how addiction manifests in the human body. This extensive clinical experience brings us to his definition of master-level energy healing, which is a really crucial distinction here.
Because master level in the wellness space is a term that gets thrown around a whole lot. Someone takes a weekend seminar and suddenly they have a certificate declaring them a master.
Oh, Osman is highly critical of that. He points out that there are many people holding paper certifications declaring them a master, but they do not energetically operate at that level.
Right. So what is his standard?
For Osman, being a true master is entirely empirical. It means possessing a substantive, proven, high success rate for the recovery of serious, life-threatening ailments and conditions, specifically including severe drug rehabilitation.
It's not theoretical. You don't spend half a century working with thousands of people who are quite literally fighting for their lives without learning exactly what works and what fails.
Absolutely.
The stakes are simply too high for placebo wellness.
They are, which is why his ultimate formula for success is so compelling. If we connect this to the bigger picture, his holistic approach is defined just as much by what it includes as by what it absolutely refuses to ignore.
You're talking about the integration with the medical establishment.
Exactly.
But I have to ask, how does that actually work in practice? I imagine a lot of conventional medical doctors would be highly skeptical, if not totally dismissive, of an energy healer calling them up to co-manage a severe addiction case.
Yeah.
How does Osman bridge that gap with a medical field that is often hostile to his life's work?
He bridges it by removing his ego entirely from the equation.
Really?
Yeah, he is incredibly pragmatic. His unwavering insistence is that he works alongside a patient's medical doctor, period. He explicitly states that he ensures medical intervention is never overlooked and that he rigorously adheres to all medical protocols laid out by the physician. He positions his ancient therapies strictly as supplementary or complementary to the clinical recovery.
So he isn't trying to override the doctor's prescription or tell the patient to ignore the clinical advice.
Never. And he notes that he does this even if the medical doctor is profoundly reluctant to work with him.
Wow.
He doesn't need the doctor to validate his energy healing. He isn't saying to the patient, choose my ancient wisdom over your doctor's science.
Yeah.
He is saying, listen to your doctor, follow their chemical protocols to stay alive, and I will help you build the mental fortitude and the physiological regulation to actually survive the journey long term.
That kind of integration, even when it is completely one-sided from the perspective of the medical establishment, is brilliant. He calls that his recipe for massive success.
And you can see why it works.
Yeah, especially from the patient's perspective. It builds an immense amount of trust.
It provides safety. The patient isn't being asked to take a terrifying leap of faith and just abandon modern medicine. They're being given a deeply rooted ancient toolkit to help them tolerate and endure the modern medical process.
And because Osman has encountered almost all types of cases over 50 years, he speaks from a place of undeniable experience.
He does.
The patient feels that conviction,
Yeah.
which is absolutely essential when you are dealing with a population that has had every pillar of their life systematically dismantled. They need something incredibly solid and grounded to hold on to.
They need the clinical science to stop the active collapse, and they need the ancient science to rebuild the foundation.
Exactly.
We have to stop treating severe addiction in silos. We cannot expect a purely physical chemical detox to magically cure a disease that is fundamentally rooted in psychological pain and behavioral habituation.
Right.
And conversely, we cannot expect meditation and energy healing to safely manage a severe, life-threatening chemical dependency. It inherently requires a dual-lens approach.
The compassion in Osman's message really shines through his strict pragmatism. He treats this as an incredibly serious, life-or-death subject matter. And his final plea to anyone listening is urgent.
It's a vital message.
Whether you are tuning in because you are seeking help for yourself or because you are desperately trying to find the patience and the strategy to support a loved one who is struggling.
Yeah.
His core message is, don't fight this battle alone.
Professional clinical assistance is always available. As he makes clear, every country has reach-out centers, rehab facilities, and medical clinics that offer free guidance.
Yep.
You can and must connect with clinical professionals who know exactly how to guide the body safely through the medical reality of physical detox.
And for those who are ready to explore the complementary side of this healing journey, to begin building that deep structural reinforcement to protect against the decade-long threat of relapse, you can explore Osman's philosophies and resources directly at yogawellness786.com.
The ultimate takeaway here is synergy. The physical body and the psychological mind are not enemies in the recovery process, and the treatments designed to heal them shouldn't be treated as enemies either.
So what does this all mean? Which brings us right back to that house on fire.
Right.
The medical fire department puts out the immediate blaze so the house doesn't burn to the ground today.
Yeah.
That is non-negotiable.
Hmm.
But it is the architect, the builders, and the ancient structural reinforcement that ensures the house can stand strong for the next 50 years.
Beautifully said.
It leaves you with something really profound to mull over.
Mm-hmm.
If the absolute most effective way to treat something as severe and devastating as a life-threatening addiction requires us to completely stop viewing the mind and the body as two separate treatment zones, how might this exact same co-management approach change the way we tackle the everyday chronic stressors in our own lives?